guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about Metoprolol. It's also known as Lopressor or Toprol. So it comes in two major formulations. One's one where you take it twice a day. Sometimes you take it once a day. And then there's the extended release version that you generally only take once a day. So it just depends on which one your doctor gives you, but both are the same medication. So it is a beta blocker. It actually slows down the way that your heart pumps. And so with that come a lot of good things that can happen. It'll lower your blood pressure. It's used for people who've just had heart attacks, if you're in heart failure, hypertension, several other things like that, all in the realm of your heart. Because again, it works strictly on your heart. It doesn't work on the plumbing aspect of it. If you've ever seen the other videos I do, I talk about the cardiovascular system, your heart system, your vessels as a plumbing system, because that's the best analogy to use. There's medications that work on these vessels and these vessels or these vessels down here, but metoprolol works strictly on the heart. And so it actually controls how it pumps, and it essentially slows it down. That's how it works. So let's get into some of these side effects that you're going to see right here. I'll post them up right here. Also, if you have any sort of liver issues, you need to make sure that your doctor knows about this. Or if you're using several different doctors, you're using specialists, make sure they all know, because the medications they give you will go through your liver, and we don't want that. So metoprolol is definitely one of the ones that goes through your liver. Beyond that, there is a black box warning for this medication for abrupt cessation. What does that mean? It means don't stop the medication without doctor's permission. You need to be titrated on, titrated off. Because if you all of a sudden stop taking the medication, you could, in severe, very rare cases, have a heart attack. So if you're trying to prevent a heart attack, you stopping the medication does not help the cause. So there have been a lot of issues with it. So just guys, please watch out. Don't abruptly stop it, or if you're off of it for too long, it will cause a problem. So just make sure that you always have an abundance and you don't forget it when you go on trips, because this is one of those medications you need to be on every single day. A lot of pharmacists will tell you you need to take your medications every single day, but there are some medications that you don't need to take every day, quote unquote. It's not medical advice, but I'm just saying this is one of those that you have to take every single day. This is not one of those where it's like, it's okay that you're not on it for a day or two. No, this is not one of those. No. So beyond that, for women who are pregnant or going to be pregnant, make sure you talk to your doctor about taking this medication. It does get excreted in your breast milk, so to those that are lactating, you need to make sure that your doctor knows, because then you don't want your baby to be on a medication that's going to lower its blood pressure. That's not good. So make sure that you let them know, and I'm sure they already know if they don't, but you also double check the doctor. So it's all, healthcare is all about everyone double checking each other. Now, there are some no side effects, and if these happen, you need to make sure that you call your doctor. Things like if your limbs start turning colors, that means your heart isn't pumping enough blood, so it's slowing it down too much. So if your fingers and your toes start to turn a little blue or a little purple, that's not good at all. That means you're not getting enough blood. We need to either cut you down on the dose or put you on something else entirely different. Confusion, problems with your eyesight, chest pain, fatigue, passing out. If you just randomly are passing out, those are not good things. You need to call your doctor right away, let them know that you're having side effects. Fatigue is a big one. So that's the one that I would consider a tolerable side effect if it can be for you. Because it's slowing down your heart, if you're a very active person, you're a marathon runner, you swim, you yoga, you do whatever, you're going to notice yourself cutting out on breath a little bit. And if that's a huge problem for you, you need to let your doctor know. But otherwise, that's just a normal side effect to have. Don't freak out if that happens to you. That's just normal, because now your heart's slowing down. What is that going to feel like? It just feels like you're just going to gas out a lot quicker. Say you are a marathon runner or something like that, or if you just casually jog every day. If you normally run about 2 miles and you notice after about a mile you're starting to have breathing issues a little bit, you're just a little bit harder to breathe, that's a side effect of the medication. Not necessarily bad or good. If you can tolerate it, great. If it's not, then make sure you let your doctor know. I think that kind of covers metoprolol, tartrate, and succinate. Don't worry about the names. Doesn't even matter. But again, if there are any in-depth questions, please make sure that you call your doctor or your local pharmacist, or call us here at Telfer Specialty Pharmacy. We'd love to talk to you. And be sure to leave us comments down below letting us know what helps, what doesn't help, what you would like for us to add to the videos. At the end of the day, these videos are for you guys. We make them to help you, and if we're not helping you, then we want to make these videos better. So again, thanks for tuning in, guys, and we'll see you next time on Meds Made Easy. Bye.